So I'm going to go on to the next set of slides then on the natural history of hepatitis C. Okay. So here you have a beautiful picture of the hepatitis C virus as we understand it at this point. For a long time, it wasn't even understood what the virus looked like. It couldn't be found. But now we know what the virus looks like and how it's composed. And here's a good picture of it. It's in the Flavi family. It has a rapid replication rate. It has a very high mutation rate, not as high as HIV. A lot of people ask about that, but it's not as high as HIV. But it's RNA dependent, RNA polymerase, lacks proofreading mechanisms, and predisposes to mutation. So for those of you who are understand biochemistry and understand that you can go back and actually there's a lot of data out there at this point specifically on mutation, because one of the things that's happening right now in the HCV world is a development of new type of genotyping that's going to help understand if people are going to respond to interferon or not, which means that there's going to be an ability to tell people whether or not they really should go on interferon or not. But that's something, you heard it first here, but it's just happening now. It's actually not a test that's available. It's in its prototype form at this point. So these are some of the questions people were asking on the we're asking over here on the side. So the incubation period for hepatitis C is around 6 to 7 weeks. So what does that mean? That means if someone is exposed or possibly infected with hepatitis C, they're really not going to know for 6 or 7 weeks, and sometimes as long as 26 weeks, as 6 months. So testing for the antibody is not particularly accurate during that period of time. So we know that if somebody is acutely, possibly has hepatitis C, what would this mean? I wish I could have you answer this question now, but I guess I'll tell you the answer. What would this mean for you? Well, it would mean testing people for the virus directly as opposed to the antibody. With acute hepatitis C, 60 to 70% of people are asymptomatic. They don't know that they have hepatitis C. Now, I bet you've never met anybody who had hepatitis A who didn't know they had it. So with hepatitis A, it's absolutely always symptomatic. And so people know when they get hepatitis A. People don't always know when they get hepatitis B, but there's many more times that there's an acute syndrome. So with hepatitis C, very few people have any symptoms when they're initially infected. Some people will have some very mild jaundice, may or may not notice it. And there can be some non-specific symptoms such as malaise, abdominal pain, anorexia. Fulminant acute hepatitis, never seen a case. If you don't know what that means, fulminant acute hepatitis is when the liver goes into failure directly upon being infected. It's what happens with people who overuse Tylenol or take too much Tylenol. They go into fulminant acute hepatitis where the liver fails immediately. And it also is reported only among people who have pre-existing liver disease. For example, people who have end-stage liver disease and then become infected with hepatitis C, or people who have hepatitis B later stage. There is a situation where people who have hepatitis C infection and then get hepatitis A on top of it, 40% of those people can go into fulminant acute hepatitis. That's a big problem, and so that's one of the reasons why it's recommended for people with hepatitis C to be vaccinated against hepatitis A, because there's a very high serious risk factor for people dying from getting hepatitis A on top of hepatitis C. The average time to seroconversion is about 8 to 9 weeks. Chronic infection in people with hepatitis C, it's very different than hepatitis B. And hepatitis B is about 5% of people develop chronic infection. 95% of people clear the virus in adults. I'm not talking about when children are born with hepatitis B. But in adults who are with hepatitis B, who are infected with hepatitis B, clear the virus 95% of the time. pretty much the reverse in hepatitis C. 75 to 85% of people who acquire hepatitis C become chronically infected. And in chronic active liver disease, about 60 to 70% get chronic or intermittent elevations in ALT or ASTs. So what is the clinical course of hepatitis C? It's insidious. And so we don't say latent because basically it's not a latent disease. The disease process is continuing over time. So latent viruses are ones where the virus just sits in the body and then all of a sudden you have symptoms associated with the virus, like with herpes simplex. With hepatitis C, there's actually a disease process that's happening in the body no matter once a person has been infected with hepatitis C. It's insidious, often asymptomatic, and oftentimes these are actually the clients that we love to see, people with nonspecific symptomatology. It's something that a Western physician can do nothing about and that Chinese medicine can do everything about. And so that's why I think that hepatitis C is such a great, people with hepatitis C, it's a great group of people for us to work with because there's so much that we can do in terms of symptomatology. I can tell you that within 1 or 2 acupuncture treatments alone, forget herbs, acupuncture alone, we can deal with pain associated with over the upper right quadrant. We can deal with fatigue. We can deal with a lot of body aches and pains, etc. That they've been having for 20 years that they had no idea that it was coming from hepatitis C. So I highly recommend people getting acupuncture right away with hepatitis C, just because you're going to be able to bring people back into the clinic and be able to help them to then understand what else they need to do in terms of hepatitis C. It's one of the reasons I wanted to talk about acupuncture first, because acupuncture is kind of the very first place. Oftentimes people coming to our clinic, they see us as acupuncturists, not necessarily as Chinese medicine doctors. And so they don't understand, I'm going to get all these other things, but I came in here to get acupuncture. So I like to, with the people who that is their situation, I really try to have them get an acupuncture treatment during the first visit in which I see them. Most of the people who I see, I actually don't do acupuncture in the first visit. I do an evaluation and then figure out their treatment plan and have them come back for acupuncture. Anyway, just an aside on that, because I think that the clinical course of hepatitis C is very specifically related to how we as practitioners, Chinese medicine practitioners, can help people with the nonspecific symptomatology. Case findings, often they're incidental until there's signs of cirrhosis or symptoms develop. And that's really important because a lot of times people don't find out that they have hepatitis C until they have signs of cirrhosis. So until they actually develop spider veins or palmar erythema, which are signs of cirrhosis, or some swelling in the ankles, or possibly even ascites, or they start having brain fog, etc. They don't know they have hepatitis C, and lo and behold, they find out they have cirrhosis. And then there's a whole other group of people who have hepatitis C, may or may not ever develop cirrhosis, but have viral symptoms. So having a chronic virus can cause a lot of symptoms for people as well. Cirrhosis, about 10 to 20% of people with hepatitis C develop cirrhosis over a 20 to 30 year period. So that's why often people have no idea they have hepatitis C, and over the course of disease, about 30 to 35 years into it, they suddenly find out that they have liver disease because of you can't see anything from the outside unless you're a hepatologist or one of us who's actually looking for those signs. Hepatocellular carcinoma, about 1 to 4% of people develop hepatocellular carcinoma. And while this seems like a very small number, if you think about how many hundreds of millions of people there are in the world who have hepatitis C, that's a lot of people. And the mortality from chronic liver disease can be 1% to 5%. I think this is being adjusted upward a little bit because now that so many more people have hepatitis C, we're understanding more about the natural course of the disease.